There is a question that many men carry silently for years. A question they rarely say out loud, not at the gym, not with friends, not even with the person they trust the most. But somewhere in the back of their mind, it stays there. Am I normal? I'm Dr. Rena, a board-certified urologist, and for more than 7 years, I have helped men understand their bodies, improve their health, and overcome concerns that often remain hidden because of embarrassment or fear. Today, we are going to discuss one of the most common yet least openly discussed topics in men's health: penis size. This is not a conversation about judgment. It is not about comparison, and it is certainly not about creating more insecurity. This is about separating medical facts from unrealistic expectations. It is about understanding the difference between what science actually shows and what society has made many men believe. Because for millions of men around the world, this topic is not just simple curiosity. It becomes a private worry, a worry that slowly affects confidence, relationships, intimacy, and the way a man sees himself. Before we continue, I would love to know where you are watching from. Share your location in the comments below. And if you find conversations like this valuable, consider subscribing, because the right information at the right time can completely change the way you understand your own health. Now let's begin with the reality. A large international study involving more than 15,000 men and published in the British Journal of Urology International revealed something very important. More than 90% of men fall within what doctors consider a completely normal range. And yet, despite this fact, research continues to show that a significant number of men feel unhappy or worried about their size. Some studies suggest that nearly 60% of men experience some level of dissatisfaction. So the question becomes, if most men are medically normal, why do so many feel like they are not? The answer often begins much earlier than adulthood. Think back to when many young men were teenagers, maybe around 13, 14, or 15 years old, a time when curiosity about the body begins to grow. Many young men encounter their first exposure to adult content online. But what they usually do not understand is that what they are seeing is not a realistic representation of the average male body. It is a performance. It is a carefully selected environment. The people shown in those videos are not chosen randomly. They are often selected because they represent an uncommon physical standard. The lighting is controlled, the camera angles are carefully created, the situations are planned, and sometimes technology can even change how things appear. But a young person watching this for the first time does not know those details. The brain simply observes what it sees and begins creating a new definition of what normal should look like. Then add other influences: locker room conversations, unrealistic jokes, social pressure, and the fact that schools rarely provide honest education about male anatomy. Slowly, an average and healthy body can begin to feel insufficient. And this is where one of the biggest misunderstandings begins: the idea that size automatically determines attraction, satisfaction, or masculinity. But when researchers ask women about this topic, the results tell a very different story. Only a small percentage, around 5 to 10%, report that size is a major factor when choosing a partner. For most people, intimacy is influenced by many other things: connection, communication, confidence, emotional closeness, and overall relationship quality. So this obsession with size is not really coming from medical science. It often comes from myths, from comparison, and from years of not having honest conversations. I have personally seen this concern many times in my medical practice. Men in their 40s, men in their 50s, men in their 60s, even men in their 70s. They come into my office carrying anxiety about something they believe is wrong with them. But after we discuss the actual medical evidence, something interesting happens. Their body language changes. Their tension begins to disappear. Their shoulders relax. Their confidence starts coming back. And that is exactly why this conversation matters, because understanding the truth can remove years of unnecessary worry. Today, I want to guide you through the science step by step. We are going to discuss how to measure correctly. We will look at the real average measurements according to medical research. We will talk about the 5 biggest mistakes men make that increase anxiety about size. And most importantly, we will focus on what truly affects male confidence, performance, and overall health. Because by the end of this discussion, you should not only have numbers, you should have perspective, you should have reassurance, and you should understand what actually matters. Let's begin with the first major mistake many men make. Mistake number 1: measuring incorrectly. This may surprise you, but a large number of men have never measured themselves correctly. And when you begin with an inaccurate measurement, you create an inaccurate belief about yourself. Some men measure from the skin instead of the pubic bone. Others measure from an angle that adds extra length. Some measure when they are not fully erect. Others measure in cold conditions when blood flow naturally decreases. All of these things can create a false result. In medical research, doctors use specific techniques to make measurements more reliable. One commonly used method is called stretched penile length. This method provides a much more accurate estimate of true length. So, how is it done properly? First, stand upright. Use a ruler or a soft measuring tape. Place it on the top side of the penis, starting from the pubic bone, not simply from the surface of the skin. Gently press into the fat pad. This is important because the fat tissue in this area can hide part of the actual base. Then, while relaxed, gently stretch the penis to its natural maximum length. The stretch should be firm enough for accuracy, but never painful. Measure from the base to the tip. That measurement gives a much more realistic understanding. For circumference or girth, the process is also simple. Take a soft measuring tape or a piece of string. Wrap it around the thickest part of the shaft. Mark the point where it meets, then measure that distance. This approach removes confusion, it replaces guessing with accurate information, and sometimes having the correct information is enough to remove years of unnecessary self-criticism, because many men are not suffering from a physical problem. They are suffering from an incorrect comparison. Now let's move to the second mistake that creates unnecessary anxiety for many men. Mistake number 2, believing fantasy instead of science. In today's world, men are constantly exposed to images and messages that create unrealistic expectations. But when we look at actual medical research, the reality is very different. A major study published in 2015 analyzed data from nearly 15,000 men around the world. This was one of the largest studies ever conducted on this topic. The researchers looked carefully at measurements from different populations and different age groups, and the results were clear. The average erect length was approximately 13.22 centimeters. That is just slightly above 5 inches. The average erect circumference, or girth, was around 11.5 centimeters. That equals approximately 4.5 inches. But here's the most important part of the entire study. Most men were not far away from these averages. In fact, approximately 90 to 95% of men fall within a range of about 10 to 16 centimeters. That is roughly 4 to 6.3 inches. If your measurement falls within this range, then according to medical standards, you are normal, not deficient, not inadequate, not somehow less of a man. You are within the range that doctors see every day. However, many men continue to compare themselves against unrealistic examples. They look at movies, they look at edited photos, they look at online content designed to create attention, and without realizing it, they compare their normal body to something that was never meant to represent normal biology. This is where the problem begins. The human mind is designed to notice differences. When you repeatedly see something unusual, your brain can slowly begin accepting it as common. But something being visible does not mean it is typical. Something being promoted does not mean it is realistic. A professional athlete may represent the peak of physical ability, but that does not mean every person should compare themselves to an Olympic champion. The same principle applies here. Uncommon examples create common insecurities. And when a man spends years believing he does not measure up, that belief can become much more damaging than the physical reality itself. The third mistake is closely connected to comparison. Mistake number 3, comparing under completely different conditions. Many men do not realize just how sensitive the male body can be to the environment. The penis is not a fixed object that looks exactly the same in every situation. It responds to temperature, it responds to stress, it responds to emotions, it responds to levels of arousal. For example, cold temperatures can naturally cause temporary shrinkage. This is a normal biological response. When the body senses cold, blood vessels change, muscles contract, and the body tries to maintain warmth. Stress and anxiety can also have a major effect. When a man feels nervous, worried, or under pressure, the nervous system can interfere with normal blood flow. This is why many men notice differences depending on the situation. A private moment with anxiety and self-consciousness is completely different from a controlled environment created for entertainment. Compare that with professional filming conditions. Warm lighting, carefully selected angles, specific preparation, high levels of stimulation, and sometimes digital editing or visual tricks. These are not equal situations. It is like comparing a casual photograph taken in poor lighting to a professionally edited magazine image. The comparison was never fair from the beginning. And when you constantly compare yourself against unrealistic conditions, your confidence will always suffer. The problem is not your body. The problem is the standard you are comparing yourself against. Now let's discuss another mistake that I see frequently in my practice. Mistake number 4, chasing size instead of focusing on health. Many men become so focused on increasing size that they begin searching for quick solutions. They look into surgeries, they consider injections, they search for products that promise dramatic changes. But the reality is much more complicated. A study from UCLA examined men who were seeking enhancement procedures, and researchers found something very important. Many of these men were already within a normal size range. Their concern was not based on a medical problem. It was based on perception. The way they viewed themselves, the way they compared themselves, the way they believed others judged them. And even after procedures, satisfaction was not guaranteed. Some studies have shown that a significant percentage of men remained unhappy after enhancement procedures. Why? Because the original problem was not always physical, it was emotional. If the mind believes something is wrong, changing the body does not always solve the deeper concern. There are also real risks associated with these procedures. Possible complications can include scarring, changes in sensitivity, pain, and in some cases, permanent damage. This is why medical professionals approach these procedures carefully, because bigger does not automatically mean better. Biology does not work that way. Male sexual health is not determined by one measurement. Performance, comfort, and satisfaction involve many different factors. In fact, beyond a certain point, additional size may even create discomfort for a partner rather than improving intimacy. A healthy sexual relationship is built on understanding, communication, and mutual comfort, not simply on numbers. This is something I want every man watching this to remember. Your body is not a measurement on a ruler. Your value is not determined by centimeters or inches. There is so much more involved in confidence and intimacy. The 5th mistake brings us to the most important point. Many men forget what actually matters. Mistake number 5, ignoring the bigger picture of health. Because when we talk about male confidence, sexual function, and overall wellness, size is only a very small part of the story. What truly improves performance is taking care of your body. Reducing excess abdominal fat is one important step. Why? Because increased fat around the lower abdomen can hide some visible length and also affect hormone balance. Improving cardiovascular health is another major factor. The same blood vessels that support your heart also play an important role in sexual function. Better circulation means better overall performance. That is why regular exercise and a balanced diet matter. Strength training, walking, healthy nutrition. These are not just general health recommendations. They directly support male vitality. Another important area is pelvic floor health. Pelvic floor muscles play a role in sexual function and control. Exercises such as Kegel exercises can help strengthen these muscles when performed correctly. Hormone health also deserves attention. For some men, checking levels such as testosterone may be appropriate, especially if they experience symptoms like low energy, reduced motivation, or changes in sexual function. But the goal should not simply be chasing numbers. The goal should be improving the entire body, because these habits do more than affect sexual health. They improve quality of life. They improve energy. They improve confidence. They help you feel stronger and more in control. So if you want to make a real change starting today, the answer is not searching for unrealistic solutions. The answer is understanding your body, respecting your health, and focusing on the things that actually make a difference. The first step is simple. Measure correctly. Stop relying on guesses. Stop comparing yourself to inaccurate examples. If you want to know your measurement, use a proper method and understand what the number actually means. A number without context can create unnecessary fear, but a number combined with medical knowledge can bring peace of mind. The second step is changing your reference point. Many men believe the average is much larger than it actually is. This happens because they compare themselves with extreme examples instead of real-world data. Remember this clearly. The average erect size is around 5 inches, not 8, not 9. not the exaggerated numbers commonly seen online. The majority of men are much closer to the average than they realize, and being average is not a failure. Being average means being part of the normal human range. The third step is focusing on what truly supports sexual health: blood flow, fitness, hormone balance, mental well being. These are the areas that have a much greater impact on performance and confidence than a measurement alone. A man who takes care of his cardiovascular health, maintains a healthy weight, stays physically active, and manages stress will often experience better overall function than someone who focuses only on size. Because sexual health is connected to the entire body: the heart, the blood vessels, the nervous system, the hormones, the mind, everything works together. The fourth step is asking yourself an important question: why am I worried about this? Is there actually a medical concern? Or is this fear coming from comparison, insecurity, or unrealistic expectations? This question is important because many men spend years trying to fix something that was never broken. They chase solutions for a problem that exists only because they were given the wrong information. Understanding the source of your concern is the first step toward overcoming it. And finally, invest in connection, because confidence is not created by a measurement. Real confidence comes from knowing yourself. It comes from being comfortable with your body. It comes from communication. It comes from creating a relationship where both partners feel respected and valued. The strongest relationships are not built around physical perfection. They are built around trust, emotional connection, and understanding. I want you to hear this message clearly. You are not damaged. You are not incomplete. And you are not defined by a single physical characteristic. Many of the doubts men carry were not created by their bodies. They were created by years of unrealistic messages, by media, by comparison, and by the fact that many men never received honest information about what is actually normal. The truth is, there is a very strong possibility that you are completely within the normal range. The concern you have carried for years may not represent a problem with your body. It may simply represent a misunderstanding about your body, and that misunderstanding can be corrected. Your confidence was never meant to depend on a number. Your dignity was never measured in inches. Your masculinity was never determined by comparison. What matters is how you live, how you take care of yourself, how you treat the people around you, how you build relationships, and how you continue improving your health throughout your life. Many men spend years focusing on the wrong measurement. They ask, am I big enough? But a much better question is, am I healthy enough? Am I taking care of my body? Am I maintaining my energy? Am I supporting my heart, my hormones, and my overall wellness? Because those are the things that determine quality of life. Those are the things that allow you to feel confident, active, and capable. A healthy body is not created by one feature. It is created through daily decisions. The food you choose, the movement you make, the sleep you prioritize, the stress you manage, and the way you view yourself. This is why I always tell my patients that health should come before comparison. Comparison creates anxiety. Health creates confidence. When you improve your body from the inside, you naturally begin feeling better about yourself. You become more comfortable, you become more confident, and you stop allowing unrealistic standards to control how you see yourself. Now, I want to share something important from my experience as a urologist. Many men come into my office believing they are alone with these concerns. They think everyone else is confident and comfortable except them. But the reality is very different. These worries are incredibly common. The difference is that most men simply do not talk about them. They keep these thoughts private. They search for answers silently. They compare themselves silently. And sometimes they carry this insecurity for decades without ever realizing that the information they believed was wrong. That is why education matters. When you understand the science, fear loses its power. When you understand your body, confidence begins to return. And when you stop judging yourself based on unrealistic standards, you can finally focus on the things that actually improve your life, your health, your relationships, your happiness, your confidence. Because at the end of the day, a fulfilling life is not created by trying to become someone else. It is created by becoming the healthiest version of yourself. Now, I want to take a moment to focus on something that is often overlooked in conversations like this: the psychological side of male health. Because while we often talk about measurements, statistics, and physical factors, we sometimes forget that the mind plays a powerful role in how we experience our bodies. A man can have a completely healthy body and still feel insecure if his thoughts are constantly influenced by comparison. And this is something I see regularly. A patient may come into my office with a serious concern. He may believe there is something physically wrong. He may have spent years searching online, reading comments, watching videos, and comparing himself to unrealistic examples. But after a proper medical conversation, after looking at the facts and understanding what is actually normal, his entire perspective changes. The physical reality was never the problem. The misunderstanding was. This is why accurate information is so important. Because misinformation does not just create confusion, it can affect confidence, it can affect relationships, and it can affect the way a man views himself. Imagine carrying a belief for 20 or 30 years that something about you is not enough. Even if that belief is completely false, the emotional impact can still be very real. It can influence how comfortable you feel with your partner. It can affect your willingness to be intimate. It can create unnecessary stress and anxiety. But when that belief is replaced with knowledge, something changes. A person begins to see themselves differently, not because their body changed, but because their understanding changed. And that is a powerful reminder that health is not only about treating physical conditions, it is also about helping people understand themselves. Now, let's talk about something else that many men misunderstand: the idea that size automatically determines sexual satisfaction. This belief has been repeated so often that many people accept it without questioning it. But human intimacy is much more complex than one physical measurement. A satisfying intimate relationship involves communication, it involves trust, it involves emotional connection, it involves understanding your partner's needs, it involves confidence and comfort. These factors play a much greater role than many men realize. A man who feels confident and connected will often have a much healthier, intimate experience than someone who is constantly worried about whether they measure up, because anxiety itself can become a bigger obstacle than any physical concern. When the mind is focused on fear, it becomes difficult to be present, and being present is one of the most important parts of intimacy. This is why improving overall health is so valuable. When you exercise regularly, when you eat better, when you sleep properly, and when you manage stress, you are not only improving your physical condition, you are also improving how you feel about yourself. Confidence comes from taking action. It comes from knowing that you are doing something positive for your body. And this confidence extends into every area of life. Another important point is understanding that aging does not mean losing vitality. Many men assume that getting older automatically means losing confidence, energy, or sexual health. But that is not true. The body changes with age. That is a natural process. However, the choices you make throughout life have a major impact on how you age. A man in his 60s or 70s who maintains good cardiovascular health, stays active, manages his weight, and pays attention to his hormones can often maintain a very high quality of life. Age is not the enemy. Neglect is. Small improvements made consistently can create meaningful changes over time. Walking every day, eating nutrient-rich foods, building strength, reducing unnecessary stress, getting proper medical checkups. These habits may seem simple, but they create the foundation for long-term health. And when your body feels stronger, your confidence often follows. This is also why I encourage men not to focus only on what they want to change. Instead, focus on what they want to improve. There is a big difference. Changing something often comes from dissatisfaction. Improving something comes from respect for yourself. Your goal should not be to become someone else. Your goal should be to become the healthiest version of yourself. That mindset shift can completely change how you approach your body and your health. So if you have spent years worrying about this topic, I want you to remember something important. You are not the only one. Millions of men have had the same questions. Millions of men have experienced the same doubts. But the solution does not come from chasing unrealistic standards. The solution comes from understanding the truth. Science gives us clarity. Knowledge gives us confidence. And taking care of your health gives you control over the things that actually matter. So as we come to the end of this conversation, I want you to remember the most important message from everything we discussed today. Your worth was never determined by a measurement. Your confidence was never supposed to come from comparing yourself to unrealistic images. And your health was never meant to be judged by a single physical characteristic. For too many years, many men have carried doubts that were built on misinformation. They believed things that were never supported by science. They compared themselves to unrealistic examples. They listened to jokes, myths, and opinions instead of facts. And because of that, they spent years questioning something that was completely normal. But knowledge changes everything. When you understand the truth, you no longer have to live under the pressure of false expectations. You can stop comparing. You can stop worrying about numbers that were never the real measure of your health. And you can start focusing on the things that truly improve your quality of life, your circulation, your strength, your energy, your confidence, your emotional connection. These are the things that create a healthy and fulfilling life. Remember, your body is not your enemy. Your body is something to understand, respect, and care for. Every healthy choice you make sends a message that you value yourself. Every workout, every nutritious meal, every medical checkup, every effort to reduce stress. These things build a stronger foundation for the future. And this is especially important as men get older. I'm Dr. Rena. Stay informed, stay confident. And always remember that taking care of your health is one of the most powerful investments you can make, because age does not have to mean the end of vitality. With the right knowledge and the right habits, you can continue building strength, confidence, and a better quality of life for many years ahead.